Welcome to Johari Fitness. I'm Johari. I recently interviewed Jim Horn of Chelsea Physical Therapy and Rehabilitation in New York. Check out what he says about healthy ways to approach fitness as well as healing after an injury.
Hi, Jim.
Hi, Johari.
How are you?
I'm doing great. Glad to be here.
Very good. Okay, so I just have a couple of questions for you today. My first question is, what are the skills that we lose with age?
Okay. I think that is a great question. Just to start, I've said many times to patients, I think that if you want to see good movement, you should just go down to your neighborhood park and watch kids run around the playground, and run and jump and swing and climb and do all of these things. And I think what happens over the course of time, the way I like to describe it is we go from moving in multiple lanes of movement and end up moving in kind of one center lane of movement. You kind of get up, you brush your teeth, you go to work, and you live in this one plane. And people risk injury when they are asked to move out of that lane of movement, so to speak, and their body is not up to the task because they haven't trained themselves. So specifically, to answer your question, two skills that I think are just fundamental things that I see a lot of older people question, well, why do I even need to do this? Is the ability to squat and the ability to get down to and up from the floor safely on their own. Those are two things that even if somebody comes into my clinic without that as a complaint, if they're coming in for knee pain or shoulder pain, I ask them if they can do these things. I screen this because I want to see if they have the capacity to do that. And then I have to explain to them why it's important. Just this morning, I was talking to one of my patients, and he told me over the weekend on Father's Day, he was playing with his 4- and his 2-year-old grandkids. And I said, that's a perfect example of why you want to be able to, in your 60s and 70s, be able to get down on the floor, because that's what kids want to do. The ability to squat, you need to be able to sit down in a chair, which is essentially a squat, or use a toilet. So those are skills that can erode, and I think it simply can be a case of use it or lose it. And I think a lot of people think, well, what do I have to do that for? So they stop doing it, and then when they're asked to do it, they run into problems.
Wow, it's very interesting. So in terms of the injury happening, after it's happened, what do you see as far as people recuperating from the injury? What are some things that they are not doing?
I think that there's two types of people when it comes to trying to rehab from a specific injury. I think you have people that need to be pushed, and you have people that need to be pulled back. So let's start with the people that need to be dialed back a little bit. We're talking about your type A personalities or your weekend warriors. No matter what their injury is, they want to take the no pain, no gain approach. They don't want to stop their running, their swimming, their whatever their activity is, and they kind of want to push through it, which I admire. They want to keep moving, but at the same time, if there is injury and there's pain associated with that injury, odds are that there's probably some tissue damage that needs to be given some time to heal. So those are the folks that are pushing it too far. So that's on one end of the spectrum. And on the other end of the spectrum, you have, of course, people who are very unwilling to move at all. And so on the spectrum that I'm referring to of doing too much and too little, you're kind of looking for that sweet spot to allow tissue to heal with a proper amount of stresses on that tissue, but not so much so that you never really give it a chance to heal on its own. Time is going to heal most things. The human body is amazing in its capacity to do so. And as a physical therapist, we're just trying to foster the best environment for a patient to get well as quick as possible.
So then my next question is, what can personal trainers do to make your life easier?
To make my life easier, I would say to make the patient's life better. I would just twist that question a little bit. Well, to answer your question, there's a couple of things. What can happen with physical therapy, somebody comes in, most people who come into the clinic come in because they're at some level of pain. Well, after the course of therapy, which should only be a finite period of time, you run the risk of turning it from rehabilitation into training or exercise. Right. And that's not what physical therapy ought to be about. At that point, the patient should be on their own. They should be going to a gym or working with a trainer or whatever. So there is a huge crossover between physical therapists or anybody in the rehab world and trainers. And I think that the two they're distinct, but there's a lot of crossover, and it's important that they have good relationships going both ways, so that if a trainer sees an issue with the gym, they can refer out to somebody that they have trust in. And likewise, on the back end of rehab, the person like myself can call somebody like you and say, I have this Mr. and Mrs. So-and-so, and I want them to continue to strengthen their back or whatever it might be. And that communication is really vital so that they don't end up back in the clinic with another injury or a recurrence of the same injury.
So we should definitely be in communication.
Absolutely. Absolutely. I have gone to gyms and met with trainers. I've had trainers come and meet me coming in to my clinic. You're a perfect case in point. I love that. I think all practitioners, whether or not you're in rehab, you're a chiropractor, a physical therapist, a doctor, communication is ultimately going to benefit the patient. And I'll add that the most important element of that communication is the patient themselves. One thing that I found in my experience is that I think far too often people are willing to defer to a white coat or a professional, an expert. And really it's up to them to call the shots. It's their body, it's their health. Sure, they can rely on experts to ask questions, but I really think it's important to tell patients this is about you and not to be too dependent on others to do for them. Hopefully that answered your question.
Absolutely. Okay.
And that's our interview. Jim and his associates at Chelsea Physical Therapy and Rehabilitation offer one-to-one treatment to their clients, enabling them to tailor each treatment to the individual's needs. For more information about Jim, go to www.chelseapt.com. Have a great day.